Weight loss surgery is also sometimes known as bariatric surgery. There are a number of different procedures around for promoting weight loss. Some of these procedures work on the basis of actually physically restricting the amount of food that goes into a patient's stomach. That could be, for instance, a gastric band that fits around the stomach and is then tightened, or an intragastric balloon that is inserted into the stomach and then inflated, or maybe something such as a sleeve gastrectomy, which involves surgically removing up to 2/3 of the stomach. Other procedures work on the basis of restricting the amount of fat that's absorbed from food, or actually sometimes a combination of that and restricting the amount of food. Those procedures are generally bypasses. Each type of procedure has its own merits, but also its own risks, and therefore it's very important that patients, before they decide what procedure to go for, are given full and proper counselling of the risks and benefits of each type of procedure. In addition, all of the procedures are inherently more risky than general surgery, because the patients have an extra layer of fat for the surgeon to get through, and also they have underlying morbidities and risk complications for this type of surgery in general. Therefore, it's very important that this surgery is only undertaken in a specialist centre with properly trained staff, including experienced surgeons, and also a centre that has suitable backup for in case of any complications. I've handled many cases across the whole spectrum of problems that we see with weight loss surgery and bariatric surgery. For instance, one of my patients had a gastric bypass, following which she had a leak from the lower bowel joint. This had catastrophic consequences for her. Our claim was that the surgeon that performed the surgery hadn't properly checked that all of the joints had been properly sealed before closing up after the surgery. It later transpired that this surgeon, whilst he was a qualified consultant surgeon, had only actually performed this surgery 6 times in his whole career before, and only 3 times on his own. Of course, he never told my client that beforehand. Another one of my clients was offered a type of gastric bypass that was completely inappropriate for her, and it was a procedure that had long since been abandoned by people carrying out the surgery. However, it was the only type of bypass that this particular surgeon had any experience in, so that was all that he offered her. Another one of my clients asked for a specific type of bypass and woke up to find that she'd been given a completely different one, and this particular bypass that she'd been given was again totally inappropriate for her, did not fit her lifestyle at all, and left her with completely horrendous complications that she would never normally have consented to. In addition to the actual surgery not being carried out correctly, I also have a lot of cases for clients and patients who have had the surgery, but then there have been delays in recognising complications when they've arisen sometime in the future. For instance, quite a common complication of gastric band surgery is for the band to either slip or to start eroding into the stomach. That set of symptoms should be recognised and acted upon promptly, otherwise there can be again catastrophic consequences. But often we found that, especially in general district hospitals, these complications just haven't been recognised, and completely different and wrong diagnoses have been given for the symptoms, and that has led to catastrophic delays in getting the right treatment for those patients. Well, we've been acting for patients who have suffered clinical negligence through weight loss and bariatric surgery for around about 10 years now, which is basically as long as these procedures have been common in this country. I personally get referrals from surgeons who are basically fed up picking up the pieces of their colleagues' negligence. We have access to a very wide database of the best experts who will help us to maximise our clients' compensation. We offer a full range of funding options. This includes no win, no fee agreements, also known as conditional fee agreements. We are able to obtain compensation to replace loss of earnings, to help fund care, to pay for nutritional supplementation or corrective treatment, corrective surgery or further therapies, and basically everything to help our clients get their lives back on track.